Finding the right Medicare plan can feel overwhelming. It can be especially hard to know how to choose between different options. Before you can pick a plan that is right for you, you have to understand what each part of Medicare covers and what it costs. Medicare Part A is hospital insurance and pays for your medical care when you are staying in a hospital. For most people, Part A is premium-free, but if you are in the hospital for a long time, you may have out-of-pocket costs. If you haven't paid Medicare taxes through a job, you may still get Part A by paying a monthly premium. Medicare Part B is medical insurance and pays for visits to your doctor, lab tests, scans, medical equipment, and IV chemotherapy. Medicare Part B has a monthly premium based on your income level. You also have to pay a yearly deductible and 20% for any medical care you get. This is called coinsurance. Part B does not have a cap on how much you have to pay out of pocket each year. This means that you must pay 20% of your medical expenses all year long. Parts A and B together are called Original Medicare. With Original Medicare, you can go to any Medicare healthcare provider. Medigap plans are additional plans that you buy from a private insurance company by paying a separate monthly premium. But Medigap plans can save you money by paying for your out-of-pocket costs under Parts A and B, such as deductibles and coinsurance amounts. Part C plans, also called Medicare Advantage plans, are sold by private insurance companies. They are an alternative to Original Medicare and include services covered under Parts A and B. The monthly premium for a Part C plan depends on which plan you choose. Part C plans have a cap on how much you have to pay out of pocket each year. This is called an out-of-pocket maximum. With Medicare Part C, you can only go to certain healthcare providers in the plan's network. If you have Original Medicare or a Part C plan that does not include prescription drug coverage, you should consider buying a Medicare Part D plan to pay for your prescription drugs. Part D plans are sold by private insurance companies. Your Part D monthly premium will depend on the plan you choose and your income level. Now let's talk about how you find the right Medicare plan for you. When choosing a Medicare plan, think of a road with 2 lanes. In Lane 1 is Original Medicare that includes Parts A and B. Then you need to decide if you want a Part D plan to cover your prescription drugs. Then you can decide if you want to buy a Medigap plan to help pay for out-of-pocket expenses. In Lane 2 is Medicare Part C, which includes the benefits of Part A and B, and usually Part D. If the Part C plan does not include Part D, then you can choose a Part D plan. If you have a Part C plan, you are not eligible to buy a Medigap plan. As you are comparing these options, remember, there are deadlines and rules that apply. Generally, once you pick a lane, you have to stay in that lane for the rest of the year. Also, it is important to pick a plan that covers your healthcare providers and your prescription drugs. When comparing plans, it can be tempting to just choose the one with the lowest monthly premium. But that does not include your out-of-pocket expenses for the year. You have to do some math to choose the right Medicare plan with the lowest out-of-pocket costs. For example, Jamie is about to begin 1 year of chemotherapy treatment, which costs $10,000 per month, and is covered by Medicare Part B. Jamie wants to know what plan to choose for the lowest out-of-pocket costs. First, Jamie looks at what her costs would be if she just had Medicare Parts A and B in Lane 1. Her Part B monthly premium is $148.50 times 12 months, equals $1,782 for the year. She also needs to pay her Part B deductible of $203. Her 20% cost share just for her chemotherapy treatment is $2,000 per month times 12 months, which equals $24,000 for the year. Adding up her premiums, deductible, and cost share, her total cost just for her chemotherapy is $25,985. Now let's look at Lane 1. If Jamie picks Original Medicare with a Medigap Plan G, her Part B monthly premium is $148.50 times 12 months, equals $1,782 for the year. She also needs to pay her Part B deductible of $203. The Medigap Plan G in her area will cost $300 per month times 12 months, which equals $3,600 for the year. But in this case, the Medigap Plan G will pay for her 20% cost share for her chemotherapy treatment. So her total costs for both premiums and out-of-pocket costs for the year is $5,585. Even though there is an additional premium for the Medigap plan, it can potentially save you thousands of dollars in out-of-pocket costs. But it is important to do the math to see which option is best for you. Jamie should also consider what her costs would be if she had a Medicare Part C plan, which includes the coverage for Part A and Part B. Her Part C monthly premium is $148.50 times 12 months, equals $1,782 for the year. Her 20% cost share just for her chemotherapy treatment is $2,000 per month times 12 months, equals $24,000 for the year. But the out-of-pocket maximum for the year is $7,550, so she only needs to pay $7,550 of the $24,000 cost for her chemotherapy treatment, and the Part C plan will pay for the rest. Adding up her premiums and cost share, her total cost just for her chemotherapy is $9,332. Based on Jamie's situation, after doing the math, Lane 1 with Original Medicare and Medigap Plan G turns out to cost her the least for the year. Choosing a Medicare plan is not a one-time activity. You should review your options every year to make sure your plan meets your needs. Do the math to choose an option that lowers your out-of-pocket costs. A Medicare plan that met your needs in the past may not meet your needs now or in the future. Open enrollment is the time of year that you can make changes to your plan. For more information about these topics and more, visit triagecancer.org and cancerfinances.org.